My second myth, and I'm going to debunk, is universal health coverage can be achieved by an individual mandate. According to the census, the federal census, 2/3 of the uninsured are people ages 18 to 34. Healthy people are not going to buy expensive insurance that they're never going to use. If you're a young person, take these two young gals here, I mean, you know, say you want to take a boy on a date, or you want to buy a car so you can impress young men driving around town, why are you going to spend $400 a month on health care when you're probably not going to get sick and you're not going to use it? It's a bad deal. So we need to focus on that. But the supporters of the individual mandate, people like Hillary Clinton and several governors, believe that if we legally require everyone to buy health insurance, this uninsured problem is going to disappear. And even when asked by George Stephanopoulos on This Week how she was going to enforce the mandate, what did Hillary Clinton say? I'm going to garnish ye wages if it has to be, or we will increase tax. I will find an enforcement mechanism for the mandate. Many states require insurers to charge everyone the same rate. That is what we call guaranteed issue and community rating. If you look at New York, New Jersey, Massachusetts, 3 states that have community rating and guaranteed issue, you cannot discriminate on age, sex, or pre-existing condition. Those states have the highest insurance premium costs in this country. So young people say, why should I pay so much for health care and health insurance when I'm not going to use it? It's patently, I think, unfair to force people to buy insurance that they cannot afford. Even in Massachusetts, under Romneycare, which offers substantial premium subsidies for low-income residents, the government had to exempt a fifth, 20% of the people that were supposed to buy health insurance because it was still too expensive. The program is now $150 million in debt. Only 63,000 out of the 600,000 people in Massachusetts who are uninsured actually have bought the insurance that you pay for at full price. Insurance companies have been allowed to increase their premiums. It's just a tremendous problem, and it's been a tremendous failure. And the other thing is that the woman, Barbara, I think Kinnett, who is the head of the Connector Authority and the finance director, has said with the approved new budget in Massachusetts at $869 million for health care, it's still $100 million too short. They've got tremendous problems, and the mandate is not working. And only a few people signed up for the insurance. The rest of them said, I'd rather pay the fine of $217 and lose my personal income tax deduction rather than buy insurance. So it's proved to be a complete nightmare, and the mandate has not worked. The way to attract young people into the insurance market is to lower premiums and to allow them to buy the type of insurance that fits their individual needs. This can be done by reducing costly mandates and regulations, such as in Massachusetts, in vitro fertilization is one of the mandates. I gave a speech a couple of years talking about mandates and the cost, and I said, you know, in Massachusetts, with an in vitro fertilization mandate, which really costs about $15,000 to $20,000 per treatment, Massachusetts has the highest rate of in vitro fertilization births in the country. So a man at the back goes, oh, yes, this is Sunday morning too. And he said, well, does that mean that people in Massachusetts don't have sex anymore? Oh my gosh, this is not my area. But I thought quickly and said, you should ask the senior senator from Massachusetts. So, we can reduce costly state mandates. We need to allow people to buy insurance across state lines. And one of the best politicians on this issue is Congressman John Shattuck from Arizona. Because if you live in Idaho where there are only 16 mandates, you're a young person, you can buy the type of insurance that fits your needs. I mean, here in California, there are only 3 states that don't mandate auto insurance. California, 25% of drivers are driving around without car insurance. There's a mandate. You go to the DMV to get your license, you show you have insurance. The next week, these people cancel insurance. They're young, why should they pay that? And they're never going to get in an accident. So you cannot mandate, it doesn't work. It hasn't worked in Massachusetts, it hasn't worked in the auto industry.